And these dust outbreaks occur at any given time, but most preferentially occur generally between January and September. And they impact large areas of West Africa. The health aspects are not clearly known at this time. There have been studies downstream and in Europe, and there are health impacts from Saharan dust. I'll go into those. But this next cartoon just gives you an idea that Saharan dust can be found at the surface, so from the surface to about 2 kilometers during the winter and spring season, where it can pose air quality hazards. And in the summer season, it's actually located above the monsoon layer, generally between 1.5 and about 5 kilometers. And these are smaller particles, generally about 2 microns, and they can travel all the way down to the Caribbean or to the United States or be carried up into Europe. The winter season outbreaks often occur with large mid-level circulations from the Atlantic or from Europe that often form a couplet where you find a ridge and trough which accelerates north-south winds, and they can come to the surface and we get a dust event. And again, during this time period, the dust would be found at the surface. Here's an example of a very large dust event. This has been reported in the literature both from a modeling perspective and also the synoptic events that led up to this large dust event. This is from Dakar, Senegal, and I was actually there. It gives you a real good sense that the dust is located near the ground. Visibility on this day was probably on the order of 100 meters or less, and it looked like a fog, but a very large number of particles were suspended near the ground. Now, during the summer season, the dust, as I said, is actually located aloft at higher altitude, and scientists like Prospero and Toby Carlson and Karian Pudi have clearly identified this layer as the Saharan Air layer. The Saharan Air layer usually becomes initiated sometime in May or so, and it's a very stable layer with high dust concentrations and low relative humidity. And one often finds it somewhere in the 900 to 500 hectopascal layer. The next segment here shows a small movie, a small clip that gives an idea of how a dust event might occur. This particular dust event occurred in July of 2010 and began in Algeria. And essentially, it came downstream. Along the way, there were new dust sources that were picked up, and it was one of the bigger events in 2010. And in fact, it traveled well across the Atlantic. The magenta color gives you an idea from EUMETSAT about the intensity of the dust. So that's how we identify dust products with the EUMETSAT product. So here is a picture from Dakar, Senegal on the 6th, prior to the large dust event arriving, where you can see the solar disk is clearly visible. And here is the next day, July 7th, as very large amounts of dust were over the city. We can barely see the disk of the sun. We measured aerosol optical depth of approximately 3.5 to 4 that day, and this was verified with both MODIS and AERONET products. So I just wanted to give you an idea here about climatology. This is the annual climatology. And what we find here is that the largest aerosol optical depth, this is from the deep blue product, is found across a latitude of about 15 degrees. A very large AOD can be found near the Baudelaire Depression, again, the largest dust source in the world. If we expand this to look at it from a seasonal point of view, we start at the top with December, January, February, and once again, we can identify the Baudelaire Depression here in Chad with higher values extending across the zone at 15 north. When we get into March, April, May, again, we see very high values across the latitude zone of about 15 north, and again, the Baudelaire Depression is obvious in this picture. We move into the summer season, and we continue to see high values of aerosol optical depth across 15 degrees north. This also extends a little bit further. Now, the difference between March, April, May, and June, July, August is that the dust here in March, April, May is near the surface, and during the summertime, it's suspended above the surface. And during September, October, November, we see much lower values of aerosol optical depth. So now let me just talk about the linkages to respiratory disease. There are transmittable diseases that we need to worry about in the spring, and that would be meningitis, and I'm going to talk a bit about that. But measles and influenza are also transmittable diseases that are in play during the spring. During the spring and summer, we go to this kind of non-transmittable respiratory disease where asthma, COPD, and bronchitis become important. And again, these are smaller particles during the summertime, so less than 2 microns or around 2 microns, and so they have a much greater impact on the lower respiratory system. So again, looking back at these two time periods, during March, April, May, we find very high levels of aerosol optical depth across 15 north, and then June, July, August, again, very high optical depth between 15 and 20 north. And I show you that because we're going to now link it to the respiratory diseases. So just first of all, here's the upper and lower respiratory tract. And during the winter time, winter, spring, there is the possibility of large particles impacting its nasal throat area. So in particular, this area is important. And again, we find measles and meningitis being important, and I'll explain it to you. During the spring, summer, more like the summer season, the smaller particles have the ability to go into the lung system, and so asthma, bronchitis, and COPD become important during that time. But again, the data is very sparse. We have limited data which supports this. So meningitis, a little bit about it, it is a transmittable respiratory disease, and it occurs through human contact. There's a 10 to 20% fatality rate, and of course there are other aspects of this disease which are not good, such as becoming deaf in a part of the body or losing a limb. There are other things that happen with the disease. There are multiple strains of the diseases, ABC, W135, and there have been large vaccination programs for the serogroup A across much of West Africa. It does occur in Africa. There is a meningitis belt. I'll show you that in an upcoming slide. And at any time, 10 to 15% of the population may be carrying a strain of meningitis in the nasopharynx area, so in that throat, the nasal throat cavity. So how might poor air quality from large dust concentrations impact meningitis? First, the large particles have the ability to destroy tissues in the nasal area. And then if there are carriers, scratches or cuts make it more likely that those persons will become infectious. In addition, large dust concentrations increase indoor activity. so it would increase the spread of any transmittable respiratory disease. And finally, dust particles are likely covered with bacteria, viruses, or fungus, and some of these are pathogens, increasing the susceptibility to meningitis. Meningitis is known as an opportunistic disease, and so one often finds people who have the disease, they often have influenza or pneumonia. So all of these could play a role. The next picture shows the global distribution of meningitis, and if you note, here's the zone where A and W135, C and X occur most frequently. The serogroup A has largely been eradicated globally, and you'll find it still in a few places. So let me move to the next slide, which shows the meningitis belt. So the meningitis belt goes from Senegal all the way across to Ethiopia. And below, here are the number of cases. So we have these irregular periods of epidemics. The largest occurred during the winter-spring of 1996, when there were up to 250,000 cases reported across the meningitis belt, and some 25,000 fatalities. Now, I just showed you the meningitis belt, and you will see, again, looking at the climatology on an annual basis, that it overlaps the area where the highest aerosol optical depths occur. So there's, at minimum, some type of causal link between high aerosol optical depths and meningitis cases. Here's another picture showing you the seasonal pattern of meningitis. It is a dry season disease. So it is in very, what we say, endemic, very low number of cases during the period of June to about November. And then we go into a hyperendemic state where the cases begin to increase after December, and then we see a large number of cases, or minimum of 5 to, say, 9, 10, 9 per 100,000 during that period, with a big peak occurring around March, April. This picture also shows that this dashed line, so the single lines are cases, number of reported cases in Burkina Faso, and then this is the relative humidity. So once the relative humidity begins to increase, which is here on the right-hand axis, the number of cases go down, okay? And this pattern, again, has been repeated in many West African countries. This next figure shows some work by Arti et al., and they show that here in red, the number of meningitis cases and the number of measles cases are closely related, with peaks occurring in March and April. And then in blue, we have the rainfall in Niger. So once the rainfall levels go up, the number of cases for both measles and meningitis go down. Here is this next picture shows you the number of estimated suspected or probable or confirmed cases. And to do confirmed cases, you actually have to take fluids from the spine for 2012. So 2012, there were 17,000 cases across these countries in West Africa, about 1,351 fatalities. You look across, the country I'm going to focus on is Senegal. That year, there were 894 cases. If you look 2 countries over to Burkina Faso, there were nearly 7,000 cases of meningitis. And if you go over to Chad, there were nearly 4,000 cases. If we jump to 2013, we find a lower number of cases. So in blue, compared to the year before, if the color is blue, that means there are less cases. We have 379 cases in Senegal. If you look over to Burkina Faso, there are about 3,000 cases, so a decline of about 4,000 cases. And the largest change was here in Chad, where there were only 371 cases reported. There were a few countries that had slightly higher numbers of reported or suspected meningitis. Next, I'm going to show you, compare to you what happened in 2012 versus 2013 for aerosol optical depth from deep blue. Here's February 2012. We see aerosol optical depth being relatively high across the zone around 15 north. If you compare that to February 2013, we see much lower values, although there are some areas of higher AOD here in the central part of this region. Compare March, we see much higher AOD values as compared to March of 2013. So the dust loading was likely higher during 2012 as compared to 2013. Here's the number of meningitis cases, and basically it's the difference. So red is 2012, blue is 2013. So the biggest differences occurred during March, April, and May, where there were significantly more cases, and I'll show you the weekly values in the upcoming slides. So many more cases during March, April, and May. And the serotype was 135. Again, I said there were large vaccination programs in Senegal. This serotype 135, there have not been any large vaccination programs as of now. In Senegal, there were reports of meningitis in all districts. One of the hardest hit districts was the one that I pointed out earlier when I talked to you about Touba. So Touba had one of the highest values, highest number of cases that were reported during this meningitis outbreak. Now, next thing I'm going to do is show you some of the very limited data that we have at the ground as it relates to PM10. The main point of this figure is that this is the U.S. Air Quality Index. The main point is to let you know that we get to these hazardous levels for PM 2.5 if we get greater than 250 micrograms per meter cube and more than 425 micrograms per meter cube for PM10. And again, I'm interested in PM10 because those are the larger particles, larger aerosols that can destroy tissue or nasal tissue. So here in this next picture are the weekly cases in black, okay? And in blue, these are PM10 measurements from Dakar, Senegal. And they were taken by the Ministry of Environment. And this is for the period of January 1st through March 31st of 2012. So during this period, we had a minimum of 8, what could be considered 8 hazardous events. So they were distinct events from January through March 31st. And these values, again, are much higher, so more than 800 micrograms per meter cube, much higher than anything that we might find in the United States. But here's the point. This last period, basically between February 20th to about March 20th, there were 4 very large dust events where we had hazardous air quality. And during that time period, we saw a rapid uptick in the number of meningitis cases. Okay, that uptick continued through late April, and then it fell off. There were some smaller dust events in April and May, but they were lower. So here's where March 31st. This is the end of March. This is when the end of the numerous dust events occurred. So what happened after March 31st? These events were much smaller. The disease continued because, again, it can be transmitted person to person. The aerosol optical depth, which is shown here for both MODIS, and for MODIS, this is averaged over the entire country, and for AERONET, it's at one site at Mbor. What we find is, you know, here the number of cases in black, and then on your right-hand axis, these are our AOD values. The thing that the aerosol optical depth shows that we have this increasing values as we go into the month of March. And that, again, corresponds to the uptick in the number of cases that were observed. Beyond that, we still have high values of aerosol optical depth, but at some point in time, some of these events are suspended in the atmosphere. The dust is suspended, so it may not be at the surface as we go into May. Here's just a comparison for Senegal. The outline of Senegal is easier to see here on the right. That's the outline of the country. The point is that we have much higher values if we compare the period from February 20th to March 20th, 2012 to the period in 2013. So again, it suggests high dust loading. This is the histogram from Giovanni, just giving us the idea. So 2012 is here on the left. This should say 2013. But we have 7 events where the AOD was greater than 1.5 during 2012. And we had very few events during 2013 that had very high aerosol optical depth. I'm bringing this to a close, but this picture here just gives us some idea of how the observed PM10 here in black in Dakar compares to the red, which is MODIS, and the AERONET, which is in blue. Many of the large events are actually captured both in MODIS and AOD and in the AERONET. There are some events where, hey, the AOD is too high as compared to the PM10. And one period where that is evident is near the end of March, where the PM10 values rapidly come down, and yet the aerosol optical depth values remain high. Now, what would be the cause for that? Well, you have to consider the other aerosols that are in play. And in particular, there are large amounts of biomass burning, so this is January, February, March, and April of 2009, that occurred during the winter-spring season. So we can have smaller biomass burning aerosols aloft, and so there can be issues there in terms of what you're examining. One way to get around that is to compare the AMI UV index to the MODIS AOD, and quite often you will see that the AMI values, when they go beyond a certain point, let's say 3, those are most likely tied to biomass burning. And if you look here on the right, we see this large peak in the absorption aerosol optical depth from OMI, and it gives us a real good sense that these are probably biomass burning particles or aerosols. So this is just again showing the PM10 values in black compared to the aerosol, the AERONET, and the MODIS values, and we tend to find a much lower correlation between what we're measuring at the ground and what the total column values look like for our aerosol optical depth. Again, I think you have a decoupling occurring in April and May, where some of the events are actually elevated above the surface. So, in bringing this to a close, MODIS provides important products in data-sparse regions such as West Africa, where there may be a significant impact from air quality on respiratory disease. And again, the Saharan dust is the culprit here. It's not coming from traffic, although there are issues with traffic. The dust concentrations are so much higher than any other aerosols in the region that this is the one that we have to focus on. We found a number of connections by looking at data from 2012 and 2013 between PM10, the AOD values, and the increased and increased reports of meningitis from 2012. The combination of products allow us to distinguish dust from biomass burning aerosols. From the point of view of looking at a visible image, quite often you will see smoke above the country, but you would have to go frame by frame. Whereas if we look at these two products, we can identify those biomass burning regions and periods. So I just want to thank you for listening, and I'm open for any questions.
Okay, thank you, Greg. So what we'll do now is we will move to the question and answer period, and we will allot 15 minutes. In the lower right-hand corner, I do have Dr. Jenkins' file uploaded. If you would like to download the file, all you would need to do is highlight the file, and then you'll have an option to download that file. Okay, so any questions here? Go ahead and type those into the Q&A pod, upper right-hand corner of your screen. Let's give that a minute or so. Directly following the question and answer period, we will take a short break before our 3 p.m. Final speaker for the first day of the Giovanni workshop. Any questions, anybody? There's got to be a question or two here. Okay. Anybody have any questions? Don't be shy. Still not seeing any. Oh, okay. So here, let's see here. I've got a couple of here. Hold on. Let's see. Okay. Note to Greg from Jim Acker. You showed unsmoothed Giovanni 4 plots. You can also show the data with smoothing. So that's more of a comment than a question, but just a note to the participants as well. And let's see, from the next comment, yes, Greg, when I have a question for you, I'll have you answer verbally. Okay, so this is more so a question for Jim Acker. What features can Giovanni add to help this type of analysis? Or feedback from Greg, if you can think of any types of features that you think could be added to to improve upon this type of analysis. So Greg, did you have any feedback on that?
I think that the products are wonderful. The one thing that would be really nice is somehow to tie it in to, for example, the most visible images that one can often get through another website. So in my case, I'm often looking for the peaks in terms of what type of aerosol is this. But sometimes just having a visual would be really helpful. So linking into the other NASA database would be a nice feature.
Okay, thank you, Greg. So your next question is, how much confidence do you have in the meningitis reports?
The meningitis reports come from the World Health Organization, and I think, if anything, they might be underestimated because of the poor hospital access. In fact, quite often when there are fatalities, there must be verbal autopsies that are done because the patients don't actually pass away in the hospitals. So the numbers, if anything, may be underestimated as compared to overestimated. But there's confidence in 2012. I've been working with the doctors in Senegal, and they clearly saw an uptick in the number of meningitis cases in 2012.
Okay, I have additional questions here. Let's see. I am trying to see. Just a moment here. For some reason I'm not seeing the rest of the question. That's somewhat odd. Hold on. Okay, so Harold, initially I could see the first part of your question, which I am no longer seeing, where you had, could you please ask the first portion of your question? It was broken into two. Gosh. Odd. I don't know if you're deleting your question or what's happening, but I don't see the first question. So in the meanwhile, let's move on to the next question here. Have you looked at air's vertical profiles of humidity to find height of Saharan air layer?
The answer is we can identify the height of the Saharan air layer through airs or through typical radio soundings. And in radio soundings is very distinct. The issue is out over the ocean, and I know that there have been a number of studies that have used AIR's products for identifying the Saharan air layer. The real issue over West Africa is that if we're trying to understand the impacts over land, not really clear how well we can do that without some in situ data, and that is a real issue because in general we only have 3 or 4 radio sounding stations. The events can happen very fast, so it doesn't take a week for the event to arrive. A day or two, and we might be in Saharan air layers, and for those people in West Africa who have asthma, you would want to be able to provide the public healthcare sector with some idea that we had this very dry air with maybe very small or fine particles coming in, and they basically fall out over these large populations. So yeah, airs can be used, and I think that's really important going downstream over the Atlantic. Radiosonde data seems to be the best, along with some type of visual or AERONET sites for trying to identify if we see changes in the aerosol optical depth. Sorry for the long, drawn-out response.
That's okay. Thank you, Greg. So Harold, thank you for re-asking your question. I'm going to cover an earlier question first, and then I will go directly to yours. The next question is there any mechanism to differentiate the different aerosols, meaning the source of aerosols like biomass-based or industry-based, or just fire cracking as Diwali in India?
What I've been examining, it's hard if you're looking at the the 550 nanometer aerosol optical depth. I've been looking at the OMI UV index, and the biomass burning tends to seem to have higher values. Again, and along with the absorption aerosol optical depth at 388 nanometers, you tend to get a much better signal of biomass burning as compared to 0.5 microns or 0.55 microns. So I do think that it will take some examination of the two AOD values or AOD products or UV index products, compare those, and if there are any LIDARs, of course, in the regions, you can use other variables to examine that. I think I've been looking at the single scattering albedo, and that is also a tool that might be helpful. We should be getting lower values with the biomass burning aerosol. But I think it takes a bit of practice. You have to look at multiple products.
Okay, thank you, Greg. There was a question here a moment ago, which I am not seeing at the moment. Any further questions? Let's see. No, we've already discussed this one. The features on Giovanni adding, we've already discussed. Okay. Have you seen any correlation through Giovanni data between shrinkage of water sources, i.e. lakes, rivers, groundwater, etc., and increase in dust and desertification?
Haven't looked at that, but I believe that you would definitely see more dust if there were changes in either vegetation or large water bodies. I'm not sure if I can answer that, but I think with enough data and some pretty detailed analysis, you might be able to see a signal. The Saharan is just such a big source that it tends to just dominate any other. Like, for example, we could have Sahelian right there in that zone at 15 north. There's dust that could be picked up from there, but it's usually just outweighed by anything coming from the Sahara. It's just so much dust. And even in the summertime, when events are often elevated above the monsoon layer, I've experienced, and I have seen some just this recent year, of very large sources of dust reaching the surface in the middle of the summer. And just kind of ending up on that, there are numerous things that could lift the dust. The wintertime, we have these large synoptic features that are in the lower troposphere, but in the summertime, you could have squall lines actually lift dust and initiate the dust event. You could have African easterly waves if they're strong enough, and quite often when you see strong African easterly waves coming off the coast of Africa, the northern part of the wave will actually have lots of dust with it, and this is kind of an emerging area where we're trying to understand what is the linkage between these dust particles, which might serve as ice nuclei, precipitation, and hurricane intensity. So the point is, it's possible to do that. Again, very kind of drawn out. It's possible to figure out the land use issue. Again, I think the Saharan source is just so big that it really outweighs. You could do it maybe if you had some in situ measurements and you had and you used the satellite product.
Okay, thank you, Greg. Another question. Let's see, Keith, you had a question earlier. I think our workshop organizer, in reading your question, accidentally deleted it. But the question, I believe, was whether or not there was any, Greg had noticed any difference between viral and bacterial meningitis. If that's not accurate, could you please clarify? And my apologies.
The viral is much smaller. Speaking with, again, the healthcare workers in Senegal, it's the bacterial form which rapidly spreads and is responsible for most of the fatalities in Senegal, and I would have to believe across most of West Africa. What we did note is that there was a large difference in the circulation when we looked at 2012, with the source of dust being Algeria, whereas in 2013, the low-level flow was actually coming from the Atlantic. And so I believe that the source of the dust, and the source of the dust has whatever bacteria or pathogens on it over the desert. But I think that some of this variability that we're seeing in terms of epidemics are probably linked to circulation, but you can't take culture, or you can't take out poverty, you can't remove, immunity. All those things are built into it. The short of it is the bacteria form of meningitis is what's impacting people in West Africa to a much larger extent.
Okay, thank you, Greg. The next question is, could you please suggest how to get long-term aerosol data? So that, I don't know whether that perhaps is a question for Jim to answer with respect to the Giovanni. I'm not sure how that...
Yeah, Giovanni goes back, I think you can go back, maybe you can get aerosol data, but from one consistent platform, probably 2000, you have Terra, and then you have Aqua, but yeah, Seawith. So from the satellite, there are numerous sources that you could use.
And you know something, Krishna, this is something we can follow up with you offline as well and send you an email with some specific recommendations, if that sounds all right. Okay, and then the next question from Harold, if I want to do some related research about places in the United States, can I get some help from you or someone else? Maybe contact information.
Me, sure, you can contact me whenever you want. No problem.
Okay, so I assume that this research would be similar research related to Greg's talk. Greg, do your slides have your contact information?
Oh no, I didn't put that on.
That's okay. So this is correct, right? G. Jenkins at howard.edu?
Yes.
Are you fine if I place this in the Q&A pod?
Sure.
Okay. So I have added our speaker's contact information. Are there any further questions? Okay. I've got 2:47, so if there are no further questions, we will take a 15-minute break. Now it'll be about 13 minutes, and then we will follow up with our third and final speaker this afternoon, Ramesh Singh. Okay? All right, so I think we'll move directly to the break here. Into the Q&A pod here. So let me go ahead and, okay, about this. Well, it looks like my idea for my countdown timer is not necessarily working. So we'll go ahead and leave the Q&A up here if you have any questions, and feel free to enter those in, and we will resume